After reaching the age of 65, the human body undergoes a complex cascade of interconnected physiological transformations that create increasingly favorable conditions for leg cramps to develop with greater frequency and intensity. The cardiovascular system experiences fundamental alterations as arterial walls naturally thicken and lose their youthful elasticity through a process called arteriosclerosis, while endothelial nitric oxide production declines significantly. These changes dramatically reduce circulation efficiency throughout the body, meaning that oxygen-rich blood and essential nutrients struggle to reach muscle tissues in the lower extremities effectively. Simultaneously, this compromised blood flow impedes the efficient removal of metabolic waste products such as lactic acid, which accumulate in muscle fibers and create irritating conditions that trigger painful spasms. Compounding these circulatory challenges, kidney function gradually deteriorates with advancing age as the glomerular filtration rate naturally decreases. This decline affects the kidney's sophisticated ability to maintain proper electrolyte balance by reducing their efficiency at retaining crucial minerals like magnesium, potassium, and calcium. These electrolytes serve as the foundation for proper muscle contraction and relaxation cycles, with magnesium acting as a natural muscle relaxant, while potassium and calcium facilitate nerve signal transmission and muscle fiber activation. The medication factor cannot be understated among the 65-plus demographic, as commonly prescribed pharmaceuticals often exacerbate cramping risk through various mechanisms. Diuretics prescribed for hypertension or heart conditions actively deplete potassium and magnesium through increased urination, while statins used for cholesterol management can interfere with cellular energy production in muscle tissues. Beta blockers may further reduce already compromised circulation, and some diabetes medications directly affect electrolyte balance. Additional age-related changes include sarcopenia, where muscle mass and quality gradually decrease, forcing remaining fibers to work harder and become more susceptible to cramping. Neurological changes also occur as nerve conduction slows, disrupting the precise communication between the nervous system and muscle fibers, leading to inappropriate contractions and difficulty achieving proper muscle relaxation. Especially prepared fresh ginger tea functions as a sophisticated multi-mechanism natural solution that simultaneously addresses the complex physiological pathways underlying muscle cramping through its remarkable array of bioactive compounds. This therapeutic approach tackles leg cramps from multiple angles simultaneously, creating a synergistic effect where each mechanism enhances and amplifies the others for comprehensive relief. The primary mechanism centers on powerful vasodilation effects achieved through ginger's active constituents, gingerols and shogaols, which stimulate nitric oxide production in blood vessel walls. This biochemical process causes smooth muscle relaxation within arterial and capillary structures, dramatically enhancing peripheral circulation throughout the lower extremities. For individuals over 65, where age-related arterial stiffening has already compromised blood flow, this improved circulation becomes absolutely critical for delivering oxygen-rich blood and essential nutrients directly to cramped muscle tissues, while simultaneously facilitating the efficient removal of metabolic waste products like lactic acid that accumulate and irritate muscle fibers. The secondary mechanism involves potent anti-inflammatory action through ginger's ability to inhibit both cyclooxygenase and lipoxygenase enzymes, effectively reducing the production of inflammatory prostaglandins and leukotrienes. This dual enzyme inhibition calms hyperexcitable nerve endings and reduces localized inflammation within muscle fibers and surrounding connective tissues, helping to quiet the cellular irritation that triggers inappropriate muscle contractions and contributes to post-cramp soreness. Additionally, ginger demonstrates significant muscle relaxant properties through its interaction with calcium channels in muscle cell membranes, helping to restore proper contraction and relaxation cycles that become disrupted during cramping episodes. The warming thermogenic effect of the tea itself enhances local blood flow through peripheral vasodilation, while dramatically improving the bioavailability and absorption rate of these therapeutic compounds. This heat-enhanced delivery system ensures that the active constituents reach target muscle tissues more quickly and effectively, transforming a simple beverage into a comprehensive therapeutic intervention that addresses circulation, inflammation, muscle function, and optimal compound delivery simultaneously, achieving maximum effectiveness against leg. Cramps requires a sophisticated combination approach that strategically integrates the therapeutic ginger tea with immediate stretching techniques and precise timing protocols, creating a synergistic system where each intervention amplifies and accelerates the benefits of the others. This multi-layered strategy recognizes that while ginger's bioactive compounds work internally to improve circulation and reduce inflammation, external mechanical interventions can simultaneously address the physical aspects of muscle cramping that internal remedies alone cannot resolve. The immediate intervention protocol begins the moment you feel that familiar muscle tightening sensation. While your therapeutic ginger tea steeps for maximum potency, perform targeted stretching techniques that mechanically elongate contracted muscle fibers and break the self-perpetuating spasm cycle. The classic toe-to-nose pull for calf muscles, combined with wall-based calf stretches, physically opens compressed blood vessels within the cramped tissue, creating enhanced pathways for the tea's vasodilatory compounds to reach affected areas more rapidly and effectively. This mechanical-chemical synergy becomes particularly powerful because the improved circulation from ginger's gingerols and shogaols makes muscle tissues more pliable and responsive to stretching interventions, while the physical elongation of muscle fibers simultaneously encourages local blood flow and accelerates the removal of metabolic waste products that contribute to cramping episodes. The prevention timing strategy transforms this combination into a proactive defense system by consuming the therapeutic tea 30 to 45 minutes before bedtime, ensuring peak circulation enhancement during the vulnerable nighttime hours when cramps most commonly strike. This preventive timing allows the anti-inflammatory and muscle-relaxing compounds to establish optimal tissue concentrations before cramping can begin, while the hydration component supports proper electrolyte function and blood volume maintenance. The warming effect of the tea creates an enhanced delivery system that increases compound absorption rates and tissue penetration depth, while simultaneously providing therapeutic heat that further relaxes muscle fibers and improves local circulation through peripheral vasodilation. Understanding realistic relief timelines while maintaining a strong prevention focus represents the cornerstone of successfully managing leg cramps through therapeutic ginger tea intervention, particularly for individuals over 65 where consistent proactive approaches prove far more effective than reactive treatments alone. This comprehensive timeline approach recognizes that while immediate relief addresses urgent discomfort, the true transformative power lies in building sustainable prevention strategies that gradually reduce both cramping frequency and severity over time. When experiencing an active cramping episode, the therapeutic ginger tea begins demonstrating measurable effects within 15 to 30 minutes of consumption as the bioactive gingerols and shogaols rapidly enter the bloodstream and initiate their vasodilatory action on peripheral blood vessels. During this critical initial phase, you'll typically notice a gentle warming sensation spreading through your extremities, indicating that improved circulation is reaching previously compromised muscle tissues and beginning to deliver fresh oxygen while facilitating the removal of accumulated metabolic waste products like lactic acid. However, complete resolution of an active cramping episode often requires 45 minutes to a full hour, reflecting the complex physiological processes involved in reversing the cascade of events that create and maintain muscle spasms. This extended timeline accounts for the anti-inflammatory compounds needing sufficient time to calm hyperexcitable nerve endings, reduce localized tissue irritation, and restore proper electrolyte balance within affected muscle fibers. While waiting for the tea's effects to fully manifest, complement the internal therapy with immediate mechanical interventions, such as gently pulling your toes toward your nose for 20 to 30 seconds, followed by wall-based calf stretches that physically elongate contracted muscle fibers and enhance local blood flow. The prevention paradigm represents where this ginger tea intervention truly excels, transforming occasional symptomatic relief into sustained protection through consistent daily implementation. When consumed regularly as part of an evening routine, typically 30 to 45 minutes before bedtime, the tea's therapeutic compounds maintain optimal tissue concentrations that prevent cramping episodes from developing rather than merely treating them after they occur. This preventive approach typically demonstrates measurable results within 1 to 2 weeks of regular use, has improved baseline circulation, reduced systemic inflammation, and enhanced muscle fiber function, create an internal environment that naturally resists cramping triggers. Within the first week of consistent use, most individuals notice subtle but significant improvements, including fewer nighttime awakenings, faster resolution when occasional cramps do occur, and reduced next-day muscle soreness following any cramping episodes. By the 2nd to 4th week, baseline cramp frequency typically trends downward as the cumulative benefits of improved hydration habits, enhanced circulation, and reduced chronic muscle irritation compound to create lasting physiological improvements. The ginger tea serves as the cornerstone of a comprehensive anti-cramp lifestyle routine that extends far beyond the beverage itself, encouraging the adoption of complementary habits that amplify its therapeutic effects. When someone commits to a daily tea ritual for prevention, they naturally become more attentive to maintaining adequate hydration throughout the day, performing gentle evening stretches, and monitoring their dietary intake of cramp-preventing minerals like magnesium and potassium. This holistic engagement creates powerful synergistic effects where each intervention enhances and accelerates the benefits of the others. This prevention-focused approach recognizes that sustainable cramp management requires addressing multiple contributing factors simultaneously rather than relying on any single intervention. The consistent timing of tea consumption helps establish circadian rhythm support, while the ritual itself provides a calming transition into sleep that may reduce stress-related muscle tension. Over time, this comprehensive approach builds resilience against cramping triggers, ultimately leading to sustained comfort and significantly improved quality of life for individuals who previously struggled with frequent, debilitating muscle spasms. Safety-first medical awareness becomes absolutely paramount when implementing therapeutic ginger tea for leg cramps in individuals over 65, as this demographic typically manages multiple chronic health conditions, takes various prescription medications, and faces unique physiological vulnerabilities that can transform seemingly benign natural remedies into potentially dangerous interventions without proper medical oversight. This comprehensive safety approach recognizes that while ginger possesses remarkable therapeutic properties, its potent bioactive compounds can interact with medications, exacerbate existing conditions, or mask symptoms of serious underlying disorders that require immediate professional medical attention rather than home treatment. The most serious safety consideration centers on ginger's well-documented antiplatelet and mild anticoagulant properties, which occur through its inhibition of thromboxane synthesis and platelet aggregation pathways. For individuals taking prescription blood-thinning medications, including warfarin, heparin, apixaban, rivaroxaban, clopidogrel, or even daily aspirin therapy, regular consumption of therapeutic ginger tea can significantly amplify these medications' effects, potentially pushing clotting times beyond safe therapeutic ranges. This interaction creates genuine bleeding risks ranging from excessive bruising and prolonged bleeding from minor cuts to life-threatening internal hemorrhaging, particularly dangerous for older adults whose healing capacity and physiological reserves are already compromised. Additionally, ginger demonstrates glucose-lowering properties that can enhance the effects of diabetes medications, including insulin, sulfonylureas, metformin, and other anti-diabetic drugs. This interaction occurs because ginger improves insulin sensitivity and enhances glucose uptake by muscle tissues, potentially causing unpredictable hypoglycemic episodes that can be particularly dangerous for elderly individuals who may not recognize early warning signs or may experience more severe consequences from blood sugar fluctuations. Individuals with chronic kidney disease or compromised renal function face heightened risks when implementing new therapeutic regimens, as their reduced glomerular filtration rate impairs their ability to process and eliminate compounds effectively, potentially leading to unexpected accumulations and interactions. Those taking ACE inhibitors, angiotensin receptor blockers, or potassium-sparing diuretics for blood pressure or heart failure management require particular caution, as these medications already affect electrolyte balance and kidney function in precisely calibrated ways that regular ginger consumption could unpredictably alter. The circulation-enhancing and mild vasodilatory effects of therapeutic ginger tea, while generally beneficial for cramping relief, can potentially interfere with carefully titrated cardiovascular medication regimens designed to maintain specific blood pressure targets, heart rate parameters, or fluid balance. Individuals taking beta blockers, calcium channel blockers, or other cardiovascular medications should understand that ginger's physiological effects might enhance, counteract, or create additive effects with their prescribed therapy in ways that require professional medical monitoring and potential dosage adjustments. Certain cramping patterns and associated symptoms indicate serious underlying medical conditions that demand immediate professional evaluation rather than home remedies, regardless of how effective natural interventions might seem for typical muscle cramps. Cramps accompanied by unilateral calf swelling, warmth, tenderness, or skin discoloration could indicate deep vein thrombosis, a potentially life-threatening condition requiring immediate anticoagulation therapy. Similarly, cramps that occur consistently with walking or physical activity and resolve with rest may signal peripheral arterial disease, requiring specialized vascular evaluation and intervention to prevent tissue damage or limb loss. Neurological red flags include cramps accompanied by persistent numbness, burning sensations, weakness or balance changes, which may indicate peripheral neuropathy, spinal stenosis, or other nerve-related disorders requiring specialized diagnostic evaluation and treatment. Systemic symptoms such as diffuse cramping with unexplained fatigue, weight changes, or temperature intolerance could reflect thyroid dysfunction, vitamin deficiencies, or other metabolic disorders that require comprehensive laboratory evaluation and targeted treatment rather than symptomatic relief. Establishing open, comprehensive communication with healthcare providers represents the cornerstone of safe natural remedy implementation for individuals over 65. Before beginning any therapeutic ginger tea regimen, patients should provide their healthcare team with a complete medication list, including prescription drugs, over-the-counter medications, supplements, and other herbal remedies to allow for proper interaction screening and monitoring protocols. This communication should include discussion of cramping, frequency, severity, timing, and associated symptoms to help differentiate between benign muscle cramps suitable for home treatment and patterns suggesting underlying conditions requiring medical intervention. Healthcare providers can also establish appropriate monitoring parameters such as periodic blood work to assess electrolyte levels, kidney function, liver enzymes, and clotting parameters for patients at higher risk of complications. Safe implementation requires starting with conservative dosing, using typical culinary amounts of fresh ginger, approximately 2 to 4 grams daily, while monitoring for any adverse effects including gastric irritation, heartburn, unusual bruising, bleeding, skin reactions, or cardiovascular symptoms such as palpitations or dizziness. Individuals should maintain detailed records of cramping frequency, ginger tea consumption, and any changes in their overall health status to facilitate meaningful discussions with their healthcare providers. Timing considerations become crucial for safety, with evening consumption requiring careful balance between therapeutic benefit and practical concerns such as increased nighttime bathroom trips that could increase fall risk. Patients should implement fall prevention strategies, including adequate lighting, stable footwear, and gradual position changes, particularly when rising from bed during nighttime hours when ginger circulation enhancing effects might cause temporary dizziness in some individuals.